I don't really care how many nursing facts you have memorized. If you can't connect them, anticipate what's coming next, or asking yourself why. That's important because otherwise you won't be able to save your patient.
Every year, patients are harmed simply due to the fact that nurses don't know how to think. Now, that does not mean that they don't know facts. We know that we all know and understand facts. The problem is that we do not always know how to tie those facts together to have good judgment. And that's going to be the most important thing.
Today we're talking about critical thinking. We have our facts, which helps in critical thinking, but that leads to clinical judgment, which leads to safe nursing practice, which leads to passing the NCLEX. We are going to teach you how to think before you act. This is the Nursing Navigator.
Nursing Navigator's here. Wipe away those study tears. Hurst, review's got your back. Listen close, stay on track.
If you're in nursing school, you can spit out some facts. You've got your flashcards that you can regurgitate, but it's not enough. It's really not when it comes to critical thinking. You have to be able to reason with the facts at hand.
We talk about critical thinking all the time, and the issue is that we just talk about it, and nobody ever explains how you do it. The books can't explain how you do it. And so we need to talk about some steps that actually help us with the process of critical thinking.
So we're going to connect this to nursing school, and we're going to connect it to the NCLEX. So what are you going to get out of today's episode? Well, we're going to cover the 3 foundational aspects, ACT, on how you can build your critical thinking skills. And we're going to even incorporate a game for each one that you can take with you to the clinical setting, in your study sessions, and in the classroom to build those critical thinking muscles. AG, we have a little acronym, ACT. Think before you act when it comes to critical thinking. A, ask why. C, connect the dots. And T, think ahead. Why is this important for our listeners?
Critical thinking leads to good clinical judgment. Mm-hmm. And if you've got good clinical judgment, then that leads to safe nursing practice. And then if you are able to safely take care of patients, then that's what the NCLEX is actually looking for. So that's going to help you on the NCLEX. And I think just like you said, the issue is that this is not just about recalling facts. And that's not what the bedside is for. That's not what clinical is for. And that's surely not what the NCLEX is trying to see if you can do. They want to know, can you take what you already know and use that to show that you have good clinical judgment and are able to be a safe nurse?
It's a muscle that we've got to keep working because it's our brain. So we are going to do a little workout today and build those bridges and practice and talk about how we can practice. What is our daily sit-up or push-up count going to be? But instead of that physical exercise, it's going to be things that you can take away in your clinicals. That way you are working out that muscle and reiterating the importance of critical thinking. Are you ready to do our warm-up?
Let's go.
Okay. Step 1 in ACT, ACT. We are A, asking why. Can you give us some examples of how asking why would present in clinical?
For sure. I think one thing I think about, and I think you and I have had this conversation before about toddlers, is that they're always asking why. Yeah. And that can seem a little annoying.
Why?
You're right.
Why? Because why?
But I think what's funny about that is that they are trying to make a connection. Mm-hmm. That is why they're asking why. They're not just asking why to be asking it. They are really trying to make a connection. And that's exactly why we ask why, too. Is so when we start to ask the why question, it takes us beyond a fact, like one fact that we just know. And it helps us to see the entire picture and to be able to start making those connections. So asking why is the best step. It's probably like out of the ones we're talking about, this is the first one and it's the best one.
Let's use vital signs as the example. There's your topic. Yep. Why?
All right. So when we take those vital signs, one of the things that we're so focused on is, did I get them? Did I get them right? Did I document them? And those are, important things. But have you ever stopped to ask yourself, well, why am I taking this? Or when I get this number, why is it like this? For example, if the heart rate has gone up really quickly, we don't just document the increase in heart rate and keep moving. We need to ask, why is the heart rate up? Because if we don't ask the question why, we're going to miss something. And if we miss something, then we're probably causing harm to our clients. So what are we missing? If that heart rate goes up, could that be hypoxia? Because tachycardia is one of the earliest signs of hypoxia. Could it be that my client's hurting, that they're in pain? Some people's heart rates go up when they hurt. Okay, so we have to ask ourselves, why? There is always a reason. It just doesn't do it on its own, right? It doesn't happen. So we can always take those vital signs that we get and ask the next question. Why? Why is it happening? And if we can come up with the answer as to why it's happening, then we can help our client a lot faster.
Sometimes you have to ask why more than once, because there could be multiple answers as to why.
Right.
And what we're doing is we're just going deeper. We're peeling back more layers and activating a different part of our brain. It's the same reason why we write things down.
Yep.
It will help remember, it'll help with those triggers, and it'll help in step 2 when it gets to connecting the dots.
That's right.
We use this in our teaching at Hurst Review a lot too. We like to say, if you know why, you can apply.
Yep.
Because we're applying that knowledge, but we're also able to ask why and ask why again and ask why again.
Right.
Because it's going to help us zoom out a little bit and look at the bigger picture.
So there's something that students can do. And so, yes, guys, we're going to give you an assignment, but I want you to think of this assignment as something that I can immediately go and apply. When you go to clinical the next time, I want you to take 3 things about your client that you have learned, and I want you to ask the why question 3 times about each one of those. So just to give an example of how that works is, let's say your client is on a medication. It doesn't matter what medication it is, and we already know your client is going to be on somebody's medication. And so you're going to ask yourself, why about these meds? So first, not just knowing the med and that they're taking it, but why are they taking it? That's the first why. Then the next why you're going to ask is, why does this condition warrant this med? Because that's not exactly the same answer as the first question. That helps you go a little bit deeper. And then the third why that you're going to ask is, why right now? And why this dose? Like, why is it this way? And so you can ask those questions 3 times and answer those questions 3 times. You now know way more about not only the medication, but the client's condition with the medication than you ever did before. So again, it's just making that big picture instead of that one fact.
And this is something you can do with a little workout partner,
Yep.
a friend of yours, or you can do it solo. You're really going to hate me for this one.
Uh-oh.
Why are we doing this? Why? Because asking why helps build those bridges. And it is strengthening those muscles in our brains to form stronger connections. And the stronger connections we have, the better we can connect the dots and anticipate, which we're getting into, which ultimately keeps patients safe. And that's what you want. We're feeling warmed up.
Yep.
All right, we got our muscles loose. We're moving on to C, connecting the dots. When you're asking yourself why, you're looking at your flashcards and the facts that you have memorized, you're looking at one single dot. Where does it connect to? There's no other dots. Well, this is where we have to zoom out a little bit to see what shape are we looking at.
Or a puzzle.
A puzzle.
Like a little puzzle. And they're so focused on that one little piece. And it's like, okay, that one piece is important. But at the end of the day, that one piece helps to make the big picture, the big puzzle. And so we want to make sure that we're zooming out instead of zooming in.
That helps with patterns,
Yep.
right? We know everything in the body is connected.
Yep.
Let's look at, are there other patterns? So when it comes to connecting the dots, let's use the same example, but we'll have you expand upon it more.
Yeah. Blood pressure, vital signs, that's just one part of the picture, right? And sometimes, again, we get so focused on that one piece that we've missed something else. Okay, so you got blood pressure over here, and yeah, it's elevated or low, whatever's going on with it. But then, did the client get symptomatic? Like, is the client showing you any other symptom other than just the vital sign that you took? So you have to know how, like, those two players play together. Like, what happens when we put those two players together? You get something new. Mm-hmm. You got something more than just those two pieces. You now have an early warning. Because if I've got a low vital sign and my client is symptomatic, that is a sign of something really bad
Red
that
flag.
is happening. Right. We've got a problem. And so another example, it's not just vital signs. I know we love to talk about those, but what about labs? Your client's lab and then their condition. Are they showing you anything with those labs? And if so, that's a risk cue. What are they at risk for? If I put this lab together with the way that they present, what is that telling me? They may not be diagnosed with this thing yet, And then the last one is symptoms. What symptoms do they have, and do they have a history? Because if they've got a new symptom that we never had before, and they got a history of whatever this problem is, that is a major red flag. And if I can't see that, because I was so worried and so focused on just their history, that now I don't see this new problem, then I'm not going to see the red flag waving right there in front of my face. And I need to be able to take that and go help my client. Okay, so I know that the students are probably wondering, well, how do I practice this one? Because, these tips are really clear and straightforward. Okay, so the way that we practice this one is we're going to call this one the connection journal. And it doesn't have to be some fancy journal or tons of writing that you have in it. Just have a way to write or take quick notes when you're at clinical. And so what you're going to do is you're going to write down 3 connections that you've made about your client when you're at clinical. And so that could be how the vital signs and their condition relate, or how the labs and some new finding that you see relate. So just any 3 connections that you can make. And guys, this is super important because not only is this helping with the process of learning how to critically think, there's another thing that this is going to help, and I know you're going to love this. We hate post-conference. It is intimidating, and we're tired, and we've run out of things to say. Like, we don't know what else to say. And so your teacher just starts calling on somebody, and you're just standing there and you're fishing for something to say. If you practice this, where we, throughout the shift, throughout the clinical day, write down the connections that we're able to make, that's what we can also share at post-conference. And it's not only going to help our patient, it's going to help the way that we present in post-conference. Our teacher is going to be like, wow, like, when did you learn how to do that? And you're like, thanks, I watched the Nursing Navigator podcast from Hurst Review, because it's so helpful and it just has more than one use.
We're killing 2 birds with one stone here. But really what we're doing is reinforcing that pen to paper, which we talk about all the time. This is why we have a fill-in-the-blank student workbook, because studies show that when you physically write something down, it not only helps you memorize, which we addressed, memorization is the first step, but then how are we applying the facts that we memorized to be critical thinkers? And this is helping those neural pathways in your brain be able to say, okay, here's this fact that I have, and then we're taking it deeper by applying that knowledge, asking ourselves why, and connecting the dots to allow us to zoom out a little bit. Right. Because remember, we're building patterns here. We're trying to figure out with our little detective microscope lens, yes, do we zoom in on this, and are we going to focus on that? And when do we zoom out and kind of feel out the scene? Right. And setting the scene, that kind of gets us into our third point of the T in ACT, A-C-T. So T is thinking ahead and anticipating. What other players are going to come into the picture? What other pieces are going to be added to the table on my puzzle board that I'm looking at? And by allowing this, we have already addressed why. Now we're connecting the dots, and now we're really, truly applying the third principle to be critical thinkers. Right. Anticipation. It sounds like another A word that we use quite often here of assumption or assuming. So, Ashley, please define the distinction between assumptions or assuming and anticipating.
Yeah. When you anticipate, you're taking what you already have. You're taking what you've been given, and you are saying, okay, what can happen now? what can happen next? Or what we like to say is assume the worst. Because if you're going to assume, you better make sure you assume the worst about it. What's the worst thing that can happen? And so the key distinction there is making sure that you have the data to back it up. And so a perfect example is, let's say that you got a client with diabetes. An assumption is you say, oh my goodness, my client's got diabetes and they're just going to crash out. Like they're going to crash. Well, you didn't have you had nothing there. There was nothing there to make you think that they're going to crash.
They're
right?
assuming the worst,
right? They're
which is
assuming
what
the
we
worst.
teach. But when we have evidence to bring into the picture,
Right.
that's where we can anticipate.
That's right. Okay, we couldn't get there if we didn't have the evidence. And so the difference is that when you anticipate with that same scenario, that's saying my client has diabetes.
Which is a fact. So there's our fact.
Yep. And I know that people who have diabetes can experience hypoglycemic episodes. And so if they have hypoglycemic episodes, I need to know what that looks like.
Why?
Because if I understand the signs and symptoms, I can go ahead and try to fix those signs and symptoms before they occur. But if I see those signs and symptoms, that lets me know that they're getting hypoglycemic, and hypoglycemia is scary.
And you're connecting those dots
there.
There.
Right, because if they're hypoglycemic, then that's the most acute problem that they can have. That's actually more acutely worse than being hyperglycemic, and that can equal vascular damage.
And that's what you're anticipating.
That's what I'm anticipating.
There you go.
Yep.
I like that we did that short little example.
Yep.
Can I just tell them already?
Yeah, go ahead.
Okay. So next week, we are going to be walking through a clinical judgment standalone question. So this is going to be one that you're going to want to watch because we're going to be just deep diving into a CJ and applying the principles that we learned today on next week's episode. I like anticipating. It provides a sense of calm.
Mm-hmm.
It eliminates some stress. Even if we're thinking worst case scenario here, which assume the worst,
Right.
we like going down that route. And it's not just being paranoid, it's being practical and it's being prepared. And we want to be prepared. We want you to be prepared. So it's kind of like this mental rehearsal or this dance or this exercise, because we know that the more we practice it, the stronger we are going to be and the faster it's going to happen.
Mm-hmm.
To be able to anticipate and then act safely. Give us some more examples on how this could appear in the clinical setting for anticipating.
Yeah. One of the things that we do at clinical all the time is give meds. And that can be really stressful because our teachers expect us to know all the information about the meds before we give them. And they should. We're supposed to know things about medications. But one of the easiest ways to do this is if you apply those strategies that we've already talked about, and we say, okay, I've got to give a med. And then you go, well, what are you anticipating when you give it? Like, okay, what should happen? So you're thinking, oh, if I give the med, it has an effect. Because that is the anticipation. It should work, right? Well, then you're asking yourself deeper questions about that. How does it work? Why does it work? But then you also can anticipate the negative with the medication. Because, yeah, it might work, but then the client may also have some negative side effects, all those bad things that we don't want to happen when they take the medication. So I'm going to anticipate those too. What are the negative side effects of giving this med?
That way you can be prepared in case it goes down that route. Because this is not a textbook.
No.
It is not going to go according to plan every single time.
That's right. The client, could be allergic to the medication and never knew it. Like they've never taken this medication before, so you have to anticipate that. Another example is, what if they have a high-risk history, right? And so if I already know that they have a high-risk history of something, I want to anticipate problems from that. And that's just going to let me stay ahead of any common things that could happen. So that way, if I'm seeing signs of these, I can go ahead and handle that before my client has a major issue.
Yeah. A safe assumption there.
Yeah.
To anticipate the worst is if they have a high-risk history, they might have a high-risk future based off of how I'm acting and implementing.
That's exactly right. And if I'm not, like if we fail to do this step, think about how many things we're going to miss. Think about how many problems the client will have that we just never picked up on. And those problems could be so serious that our client dies. And we do not want our client to experience death when it could have been prevented. We want to make sure that we do everything that we can to keep our clients safe and alive. You're kind of making a prediction, right? And I know that word kind of sounds weird, but that leads to the final example is trend over time. Is that if I've got a trend, like vital signs, we love vital signs, and they're trending. And like I keep noticing that every time I take the blood pressure, it's lower. And I take it again and it's lower. And I take it again, it's lower. I don't just keep documenting that. Let me predict what that means. Like, let me predict what's going to happen. And if I can stop it. I can stop it before it actually happens.
Let's play the what if game.
Yeah.
This is a great practice for you to implement to practice your T of thinking ahead and anticipating. So this is a challenge that really you can start now. You don't have to wait until you're in the clinical setting. But what if? Let's try to predict what could happen next. And if that scenario plays out, how can I best respond to keep the patient safe? So you got your homework. Ask why. Then ask it again. And then ask it a third time. Connect the dots in your connection journal and play the what if game, because that's how you will feel prepared for the NCLEX and most importantly, for your patients. So what do you say, nurses? Are you ready to go act on it? Until next time, future nurses,
Current nurses,
and retired nurses. Thanks for tuning in to the Nursing Navigator by Hurst Review.
Guiding you through from school to the floor, nursing news, careers, and so much more. Learning, growing, passing the test. With Nursing Navigator, you'll be your best. Nursing Navigator's here.